My name is Ramya. My full name is Dr. Ramya Raman. I'm a GP and I'm a Perth-based GP. So I'm here from the Wild West in lovely Victoria this morning where the sun is shining, which is really nice. Yeah. So I'm a practice owner in Perth and I'm also doing some academic work. So I teach a lot of medical students. My special interests in general practice is women's health. And that's probably what's brought me here today.
I'm looking forward to this afternoon, Ramya. We're on a panel together. I was going to ask, what are you speaking about here at HIC? But I'll be up on stage with you. Tell me a little bit more about that session that we're doing this afternoon and what you feel like you'll be bringing to that.
Sure. No worries. So, as I'd mentioned, as a GP, I do a lot of work specifically relating to women's health. So I've got a lot of women from culturally and linguistically diverse backgrounds who I look after, as well as Aboriginal and Torres Strait Islander patients. Now, it doesn't mean that I don't see other patients. I'm a generalist, so I do see all patients. But the reason that I guess I'm here today is primarily because of the work that I'm doing in my clinical practice. It often shows that women don't tend to present with the very typical symptoms as described in textbooks with certain conditions, whether it be cardiovascular disease, women's health concerns, including menopause, pubertal changes, pregnancy, fertility-related concerns, or some of the chronic conditions such as like respiratory conditions like asthma or even, sort of joint conditions like osteoarthritis. And the reason for that is because with medical science, as it's evolved over a period of time, majority of the research and the data is actually based on primarily a certain population of patients. So it's based on Caucasian patients, and invariably not a lot of women have been included in the past. I'm not talking about now. In the past, haven't been included in those data sets as much. So when collecting these sorts of information, it's often skewed and probably not representative. So there is a sort of an underlying bias in that data set. So I'm actually here to talk on the panel in relation to that and what it means to a patient who is sitting in front of you and what it means to the lives of women today. Now, certainly research and data has changed a lot. So these have been identified as sort of holes or gaps, and they're starting to be addressed. But we have a fair way to go, and one of those addressing factors have been the movement of femtech.
And so, we're doing a panel discussion this afternoon in the plenary around femtech. I find, it's great to have that conversation at an event. Sometimes we run the risk at events of doing like the obligatory femtech panel and then we go, I agree. And then we kind of go back to doing like what we were doing. What would you hope people take away from our session that we're doing this afternoon and hopefully progress the agenda a little bit?
Yeah, absolutely. Two things I'm going to say. So one is I'm a clinician at heart. So I look after patients and I really enjoy that. That is like my first and best job, and I chose to do general practice because I really enjoy the variety in that. So what I would like to see is, if there are clinicians or health professionals, listening to this or perhaps come across this podcast, to try and actually have that understanding, and perhaps if they have the opportunity to get involved to make a change, then enable that change factor as well. That's one. The second part of this would be to try and see how, digital health and the movement of digital health, the impact of digital health on, community and people in real lives can actually have an influence in the way their health outcomes are. So I think there's a twofold here. There's many industries that can be involved in this space. I think there's a lot of opportunities with that.
Yeah, amazing. Lastly, any other final takeaways from here at HIC in Melbourne, or things that you hope that perhaps attendees would bring back to their health systems or to the technology they're creating that you've noticed?
I think there's a lot to take in here. Sometimes it can be really overwhelming with the changes that are coming in. But health in itself, community and patients are becoming more and more knowledgeable, and information is becoming more and more accessible. Now, with that, we also have to consider privacy factors. With that, we have to consider issues with breaches, confidentiality. I think there's a lot to take away from it as a health professional and as a consumer. So I think the key is it's coming. it's probably already come. So we better catch up with it and probably try and be ahead of that tide so that we can actually enable the consumers, doesn't matter who it is, to be well informed and better informed.